about 10 rows.
Okay.
And this is the way I think when I make up a test, okay? I say, all right, we got about 100 points for this test, right? And I say, what's most important that these students know, okay? So, the structures, like I'll have 15 structures tagged. Huh? Is it recording?
Yeah.
Okay. So structures, I will have 50, you're so good to think of your friends in the class, you're so nice. I will have 15 to 20 things tagged, and in your paper practical, I will say, I'll give you a table, item 1, name, function, or why it's important. So even if you can't remember it, just write, it's the thing next to the thing. I mean, write something, God, I can't help you if you leave stuff blank. I like go, wah, wah, wah. So put, I don't know the exact name, but I know it's related to memory. And I guarantee you, if you write that down and you get back to the table and then you start doing the rest of the practical, it'll come to you in most cases. Oh, the hippocampus. Oh, that's a V8 moment, right? Okay? So, structures will be worth about 20 points of the test. Cognitive assessment, compare, contrast, will be worth about 10 points of the test. So that's where, like, I'll put a picture of the mocha and a picture of the slums, or it'll just be a sentence or two saying, compare and contrast the mini mental with the slums. How are they alike? How are they different? So that's where you really want to make up some little table for yourself where you compare and contrast them and second guess which one I'm going to put on the dang test, right? It's just how the Spirit moves me at the moment, you know. But it's nothing that we have not covered. When I say the cognitive assessments, the ones I'm talking about are the slums, the mini-mental, the MOCA, the global deterioration scale, the coma near coma scales, the Rancho Los Amigos coma scale, the other two were the symbol digit and the trails. I'll do them in categories. I won't say, how are the symbol digit and the mini mental alike? I'll keep them in the chunks that I gave them to you, okay? So the coma ones, I'll ask you to compare and contrast the coma near coma and the Rancho Los Amigos. So you'd probably say, well, typically the coma ones are used in more low-level patients. The Rancho Los Amigos could be used low-level all the way to outpatient, upper-level patients, right? So that's why the setting is important. How long or short an assessment is might be a way to compare, contrast. The equipment might be a way to compare, contrast. And even if you don't fully, well, one has a lot of pictures and a lot of drawing on it, more so than the other one. That would be an okay answer, not the best answer, but I might have to accept it if that's true. Okay? Okay, parts of the brainstem. Might be on there. And what...
Are you looking at me?
No.
Okay.
So, What also might be on there is what cranial nerves are on what part of the brain stem. And that might be worth 5 points-ish.
Would that be label a picture?
Yeah.
Or
Yes, it probably would be label a diagram. If I do give you cranial nerves, it might be 2 or 3 of the cranial nerves, what the function is, and how you would test for it. So just like we went over today, I'll put cranial nerve 3, and I won't give the name. What's the name of it? Because I want to make sure you know that name. How would you test for it? And maybe what would be the problem if you didn't have it? Sorry. Limbic system might be worth, maybe 3 to 5 points. I might give you a diagram of it. And you have to tell me the parts. Like cingulate gyrus, hippocampus, amygdala. And that would probably be diagram-ish. Transverse brain, particularly figure A7. So here's a give me, if you know, A7 in your atlas in your book. It's at the back of your textbook. I like that picture or the one that's in your textbook of the basal ganglia. So that really is, do you know the big parts of the basal ganglia? Caudate, putamen, globus pallidus. I can't really give you that on a model very well, although there is that one model that it's on there.
Can you repeat what?
Nope, I only give this information out once. Just kidding.
What picture of the basal ganglia?
Okay, so the figure A7 in your atlas in the back of your book gives a transverse view of the brain, and then in chapter 1 there also is more of a sagittal view of the basal ganglia. One or the other of those diagrams will appear to check your knowledge of the basal ganglia, okay? But for now I'm only holding you accountable for the 3 parts: caudate, putamen, globus pallidus. Blood vessels. Might be diagrammy. Remember I said last time, the basilar artery, the vertebral artery, internal carotids. Probably that's going to be a diagram-ish, just like the one that was on your handout. Okay, so know those arteries. Cognitive hierarchy will be worth a lot of points. Probably 20, 25 points, maybe 30, somewhere there. And what I will do, I will put the cognitive hierarchy on the thing. So you don't necessarily have to memorize the cognitive hierarchy, okay? What you do have to know is what parts of the nervous system are responsible for that function on the cognitive hierarchy. So I might put the picture of the cognitive hierarchy and then put a little table at the bottom and say problem solving. And then there'll be a blank thing saying what part of the nervous system does it, how might you measure it. Okay? Attention. What part of the nervous system does it? How might you measure it? And when I say how might you measure / observe it, it might be a standardized assessment, or how would you do it maybe verbally with the patient. remember we were talking about like abstract reasoning. Well, I just asked you Proverbs. What does it mean? A rolling stone gathers no moss. I don't know. But that's abstract reasoning. Okay? Remember we did the concrete problem solving where you folded a piece of paper into a square? That's how you measure problem solving in one way observationally. Yes, ma'am.
I was looking through my notes the other day, and I didn't get the parts of the brain that are involved with abstract versus concrete reasoning.
Oh, crap. Well, if you probably said, it depends on the task you're asking me to do. If it's a motor task, like if you're asking me to watch a video and learn a dance that I've never done, that's sort of visual association and sensory association areas, right? But if it was do this Lego puzzle, that's also motor, right? I mean, you know what I mean? It really depends on the task. But the association areas, and often the frontal lobe deals with a lot of problem-solving executive function. So that's the level that I want you to kind of, if you could tell me lobe association area, cranial nerves, peripheral nerves, I'm good.
Okay. So more general.
For that function, yeah. I'm not asking you area 15, you know. Okay? Then name the association area and its function. Right? That was right from your handout, right from your book. Page 4, something, something, something. And then probably, maybe it'll be 5 points. Name the diagnosis or talk about a diagnosis you've learned about thus far in the class. What part of the nervous system is involved? Sometimes I make an open-ended question to kind of find out what interested you, or I put a diagnosis on there. So maybe it'll be brain injury, stroke, whatever else we've talked about thus far in any of the chapters. Really look at those diagnoses boxes in your chapters. And some of them are on the handouts too. That's it for the practical. That's enough. But nothing will go beyond that. So, like at the break, I think it was Lauren, or no, maybe somebody, some blonde girl, was asking me about crisscrossing. Tell everybody what you were asking, Lauren.
So in the audio, it says that the optic tract crosses, and then in the book, the tract doesn't look like it crosses. But apparently some information crosses. Some
fibers cross, some fibers stay on the same side, okay? So, when I see, I'm in my car driving, and a yellow car speeds by me, right? The yellow car, when it's about here, sort of out of my visual field, is probably just being processed on my left side of the brain, right? And then it speeds by me, and the information comes over. Whoa, that was fast. He's probably going about 80, 90 miles an hour. All of that processing of what happened visually probably is going to the opposite visual side. The acuity, something's in my peripheral vision, stays ipsilateral. So that information doesn't need to cross. Am I just perceiving it? I don't have time for it to cross. That's like a safety thing. If something, you know what I mean? So it's, in order to interpret stuff, anything that's interpreted typically crosses. Not always, but things that are just perceived at a more crude level are ipsilateral. that make sense, guys? Andrew?
Yeah.
You like hearing this the second time, you like, oh, I don't remember that from last year. It's
Yeah.
like, oh, it is good to, the more you teach it, the more you learn it too. So, you probably retained about 30% of what you learned last year. Now you're retaining more. So don't fret if you're not retaining everything here. And like different ones of you, like somebody will leave the room and go, oh, man, I nailed that cognitive hierarchy, and then somebody else will be like, I completely forgot it. But you remembered all the cranial nerves and your friend didn't. Okay, so no, that's why I study with people who don't know the same stuff you know. I don't recommend that all the psychology majors study together. You should try to study with an exercise science major if you're a psychology major, because you view the world differently by your previous training. Just saying. Might not be true, but it's just a generalization. Okay, other questions about the practical?
How many questions?
Well, I don't count questions, I count those points. So when you see this grid on the front page of the practical, it'll be a rubric. And I'm a pain in the ass. I want your name on the back of the practical. And I clearly say that on the front. And invariably, there's 2 students who write their name on the front. And I'll be like, read the friggin' instructions, people. And the whole reason is I don't want to know who you are while I'm grading your test. I want to be as objective as I can because your responses are kind of open-ended. On a multiple choice computer test, it grades it for me. Okay? I don't want to know who you are when I'm grading your stuff. Like if I don't like your handwriting, or if I particularly like your handwriting, I want to stay as objective as I can when I'm grading an open-ended sort of test. So I would rather a little more words than less words when you answer a question. I'm not saying I want a novel, but if you just say, there's a couple things that are sort of, like I told you about the ventricles. Well, I didn't have the ventricles on here. I might have a little ventricles. I have the ventricle. Oh, you know where I'll probably have the ventricles? I'll probably use the model for the ventricles, so that'll be under structures. It'll be a 1 or 2 point. But if you say lateral ventricle, I'll be like, I need to see here anterior horn, inferior horn, posterior horn. Okay? So I'll give you half credit for that. But if I gave you 2 structures with ventricles, you're going to say cushions the brain, cushions, they're both going to be the same answer. That's okay to repeat the function. Okay? Yeah.
What about the nerves for swallowing?
It might be under the cranial nerve question.
By the way, I invited everyone to this document, so if you didn't get it,
Me too.
Yes, so I kind of went off memory, even though it told me you weren't part of Google Drive. So if you use
I
a
am.
different email address, I just sent it to your Bernal one.
Okay.
So
All right.
how did you get it, Tony?
Okay. All right. Okay. So, structures. I'll put pins in the structures. I'll be real strict about not touching those models, because when the pin falls out, I'm like, damn. Under structures, hippocampus, temporal lobe, ventricles, brainstem, blood vessels, any of the structures really in chapter 1. I mean, chapter 1's the big picture for the whole course. So that's where we'll pick up a lot of the cranial nerves or brainstem parts, blood vessels. What else? Lobes, association areas. thalamus, hypothalamus.
How much time are we gonna get with the lecture again?
Usually I do a minute per question. So you'll do your practical first. I'm trying to think here, because we're doing them both in the same day, right? On the 25th. So we will I'll set up the practical in the room across the hall. And you'll do the practical first. And then when you're done, you'll do your test on the computer. I think that's the better way. You can't do them both at the same time because you can't be looking crap up for the practical. Yeah. Yeah. Make sense?
What do you recommend for the people who like to, you read a question and you're like, oh, I need to like draw out my thought, or I don't know, or take a note or something, and you only have
for the test?
Yeah.
For the computer-based test, you can put a piece of scrap paper out. Because on your national exam, they will give you a dry erase board. So I want to simulate that to the degree that I can. And usually what you do before you start the test is dump what you think you need to memorize for a test. So you'll put like dump it on your scrap paper. Right?
Okay.
Can't bring it in there with you, but you
Right,
dump it
yeah.
before you start the test.
Okay.
Yeah, which is a good thing to do.
Okay.
And that's a good practice to get into, because on the national exam, dump it on the dry erase board before you start anything. Like anything that relates to levels or, memorize-y kind of stuff is important. Yeah. All right, what else? Questions?
I was just gonna ask if you had any suggestions about the best way to go about studying for the lecture test.
Okay, so lecture test, have you been doing all the evolve quizzy stuff on the thing?
So you mean the printable worksheet thing?
Yeah. But knowing that you don't have your book with you, I hope that I picked the easier questions, you know what I mean? At least from my view. I'm not trying to minimize it, but I hope the ones that you're doing at home are going to be more detailed. The tests that I know you're doing at home and have your book, that you could look crap up. So the ones I hope that I picked for this one, I'm not saying there's no detail, but they should be a little bit more general questions. But there's still certain things you kind of have to memorize, right? So, Andrew, what would you say?
I mean, everything that you said is true, holds true all the
What
time.
was easier for you, the multiple choice test or the practical?
It was pretty even. I felt more comfortable in the practical because I know that if I could explain myself.
Right, you could always make up something. The other side of the issue is multiple choice test. The answer's there for you. At least you have to find the right answer, right? Who's a second guesser? Need to look at the room. And this is the way we want you to think as an OT. We want you to be that way as an OT, okay? But we don't want you to be that way as a test taker. So you have to go in the room with the different personality. Who in the class is not a second guesser and would consider themselves pretty good at multiple choice tests? Look.
I used to be, and then I feel like.
And then you
now-
entered this program. Yeah. Damn it. Okay. Well, we gotta find somebody in the room to be like. Because what I tell students is think like if you're a second guesser and say Marissa tends to do better on these tests, think like Marissa. What would Marissa say on this question? You know? Because Marissa's more matter of fact than I am. I'm more fuzzy wuzzy. You know? So,
I have something to say about the multiple choice questions, if you don't mind me kind of
you
describing how
chime
they come
in,
up.
baby doc.
So there's some like mix and match options, like so you'll have like a list of like structures on one side, and then there'll be like a little arrow you can click on to scroll down through options or descriptions. And just depending on the question, it'll be like, you know, what is the function of that structure, or what is like a diagnosis that occurs because of a malfunction in that structure or something like that. So if you just know like distinguishing factors between like each structure within the brain, then even if it's just like a couple that really set it aside, that really helped me out. But I'm kind of a big picture guy. I really don't like knowing every single little thing about everything because it's just
It's annoying, isn't
exactly. Exactly. It's annoying. So I just pick a couple things and just focus on that. So find what really sets something aside for you on structure and just focus on that.
Definitely, I think I would make myself tables and flashcards, but that would work for me. So definitely, based on the lab worksheets, well, do all your association areas and make flashcards for those. So the structure's on one side and maybe a picture of it, and what's the function of it. There's no pictures on the multiple choice test, but it is helpful to know where it is. And it's really a lot of what is the function of da-da-da-da.
For multiple choice?
Yeah, and in fact, it looks like in previous tests, 3 or 4 of the questions are all of the following are functions of the blank except, and so if you know 3 of the functions, you should be able to figure out which one is not a function of that. Does that make sense? I'm pretty sure we went over, know your blood vessels and where they go and what they do and what the resultant dysfunction would be. What about consciousness, coma? There's a couple little scenarios like somebody has this symptoms, they probably have a blockage in X blood vessel. So remember that colored chart in your book? So again, make flashcards with the blood vessels and what the symptoms would be if you had a dysfunction in that. Memory, what's the process of memory? How do things get in our brain? Not the exact steps. How do we create images of the brain? Remember, that's in chapter 1, CAT scan, MRI. What is the diagnostic process like that a physician goes through? What is an acute brain injury versus a chronic? What are the fields of neuroscience? This is all chapter 1 stuff. Functions of the basal ganglia. There'll probably be about 50 questions and you'll get about 60 minutes at most for it. What are the membranes around the brain, or the layers, you know, pia, arachnoid?
How do you feel about spelling on the practical?
Okay, here's my, it's like diadochokinesis. If you get that one wrong, I'm not gonna write. But if you say cerebellum versus cerebrum,
Right.
Sister, you don't get it right. Because in that case, spelling really matters,
Yeah.
right? But a word like diadochokinesis, if you approximate the spelling, I'm cool.
Okay.
Okay? So, and then like, or like in that case, if the word, if I said Another word for rapid alternating movement is, and it was diadochokinesis, right? You would say diadocho, and you say, I'm not sure about the spelling, then I kind of know you were trepidating about it. And even if you really like are clueless on the practical about something, put a joke on it, do something. This girl this summer put all Michael Scott quotes in a section where she didn't know something. And I gave her a couple points because it was funny. And, you know, at least it was a couple points because she tried, you know, she at least had a sense of humor about not knowing something. And then at least she felt like she didn't leave anything blank. You know.
What about like the, for the...
There is a couple questions, at least on the last test I did. I sort of take old tests and kind of like mix and match questions from old tests. I know I did ask something about like the phases of the swallow, what are they about, and which one, like what about, what substances, remember in the one chapter where it had the pretty, because I like the diagram, what chemicals are processed where in the brain? It like had all those purple arrows, orange arrows. No, chemical area of the brain function. So dopamine, motor function, executive function, right?
Would that be in a diagram, like that diagram?
Well, that's not on the practical, but it might be a multiple choicey kind of question. What other questions?
What about the pathway of certain like sensory or certain nerve sensory
Nope.
or the motor sensation?
Nope,
Like the eye one?
nope,
Okay.
because we're gonna get to pathways
Okay.
later on.
Because I was like,
Yeah, don't get to that detail in the chapter on the brainstem where it goes over all those pathways. You'll be like, what the hell are we talking about? Don't worry about it. We will revisit some of that content when we do chapter 6, 7, 8.
What about the thalamic nuclei, like knowing the
No, just know that the subthalamic nuclei are part of the basal ganglia. But no, you don't need to name any of that. I would like you to know epithalamus, subthalamus, and hypothalamus on a diagram. Probably I'd give you that sagittal diagram that's in chapter 1. What else? What else? You're gonna be okay. Right, Andrew?
Absolutely.
Uh-huh. You're gonna be okay. And no, again, your friends may know some things, you don't know some things, and nobody knows all of this stuff. And that's okay. You retain some of it, we're happy. Alright. Okay, models are here. So if you wanna, this is a model that I don't think we have in Norcross. We don't have one like this in Norcross? This is like the big brain, right? So, it's nice because, you know, you could see things on this model too. So you might want to take some pictures of this model. And what you might want to do too, I have some models here, is y'all can take them, plop them into a PowerPoint, and then you'll have the pictures with you to study from home. So I think that is something that students showed me. So I'll leave these out for you to take pictures at lunch, and you're on your own, guys.
Are we in here for fall meeting?
Yep. John will come here, have a good lunch. If you didn't sign up for GOTA, and you want to wait around to Amy and just go